definition of this nice concept. Submacular hemorrhage. The cause of submacular hemorrhage, variable causes: trauma, Valsalva, Terson, CNV, myopic CNV, retinal artery macroaneurysm, and so on. About the management option, anti-VEGF, pneumatic displacement with or without anti-VEGF, and the TBA, and the parsiplana vitrectomy with TBA or pneumatic. This is a case of extensive deep submacular hemorrhage due to age-related CNV. Here we are doing a vitrectomy with removal of the posterior hyaloid. Also, this case, I injected TBA 40 microgram. TBA is injected in more than one side because there is extensive deep hemorrhage. There is leaking from the macula, so you have to observe this and you have to do another maneuver like ILM flap and ILM peeling. And then fluid air exchange is enough with this maneuver. And this is a case pre-operative and post-operative with complete absorption of the hemorrhage but with little improvement of vision. This is another entity. This another case, male patient, 45 years, myope with clear, he came with clear lens extraction, and he is complaining of diminution of vision. By sonar, there was vitreous hemorrhage and shallow retinal detachment. Parsiplana vitrectomy had been done with removal of the vitreous hemorrhage. And then, after removal of the vitreous hemorrhage, I discovered there was shallow retinal detachment and there was submacular hemorrhage. In this case, I removed the posterior hyaloid. Here is very adherent because of his myope and relatively young age. Removal of the posterior hyaloid. Shaving of the vitreous base, endolaser for there was small holes. Complete the laser. In high myope, I am doing 360 degrees endolaser and the fluid air exchange. But unfortunately, the patient came with hemophthalmia and high intraocular pressure. By sonar, there was choroidal elevation. So I diagnosed the patient of suprachoroidal hemorrhage. Here I inserted trocar to evacuate the suprachoroidal hemorrhage and then completed with washing of the AC and washing of the posterior segment. Here the retina was in, but there is still subretinal and submacular hemorrhage. It was less, but there is. So I washed, and 1 minute please. I completed with fluid air and injected anti-VEGF. And this is the case, post-operative complete resolution of the hemorrhage, and here the retina is completely resolved. This is another case of retinal artery macroaneurysm after removal of the hemorrhage, the subhyaloid hemorrhage. We saw here the macroaneurysm. We have to do laser around this macroaneurysm. My message is cases of submacular hemorrhage must be evaluated thoroughly about the history, systemic assessment, and OCT very important. Early intervention to avoid photoreceptor damage. Pneumatic displacement constricted to small to medium-sized recent hemorrhage, and the TBA in cases used in case of extensive and deep intraretinal hemorrhage. Thank you. This is the
Thank you,
great
Dr.
museum in Egypt will be opened at next Saturday. Thank you.
Thank you, Dr. Bahaa. Dr. Tatiana, if you have a comment or question.
Thank you so much for a nice presentation. What is the post-op position of the patient?
So,
Post-op position of the patient? Yes.
According to the case, but in first case, according to the tamponade, but most it is prone position. Mostly, most of the cases was prone position.
Okay. We usually use vertical position of the head just to manage the displacement downward, displacement clot downward, using gravity of medication.
Okay, but in pneumatic displacement, it is recommended to do prone position to allow the hemorrhage.
Thank you so much.
Last comment with Dr.
I have just a comment about the ruptured arterial microaneurysm. We have to remember that this ruptured arterial microaneurysm has tendency for auto-infarction and self-sealing of the hemorrhage. So you don't intervene in these cases of ruptured microaneurysm except if the hemorrhage is extensive and it did stay for a long time, because sometimes it disappears spontaneously.
Thank you, Dr. Bahaa. Our next speaker is Dr. Hussein Khagan, and plug the best.